very carefully before making such a move. On air ventilation units, or some of the £90+ billion extra the government has provided to the health and care system during the course of this pandemic, some of it has gone, of course, onto air ventilation units, and we should continue to support that, and as has a lot of extra funding gone to people to support them financially if they are asked to isolate, and it's important that that is something that is both kept under review, but that is something that continues to be taken seriously. He mentioned lateral flow tests and testing, something about charging for them. It might be his policy, but it's not this government's policy. I don't know where he's got that one from, but we have no plans to charge for lateral flow tests. And then lastly, on July the 19th, what that is a step forward on our roadmap, as we've clearly set out. The pandemic is not over. It's a very significant step forward. And he talked about reviews, and I've just set out, Mr. Speaker, in September, we will have a review to make sure that we're properly set up for autumn and for winter.
Let's come to the Chair of the Select Committee, Jeremy Hunt.
Thank you, Mr. Speaker. The virus today is a totally different creature to a year ago, with only 1 in 40 new cases being hospitalised, an average age for new cases of 25, and all over 40s being offered 2 jabs, accounting for 99% of the age group that have had COVID fatalities to date. So the government's approach is entirely reasonable. But does the Health Secretary agree that there remain, to paraphrase the late Donald Rumsfeld, a number of unknown unknowns and known unknowns, not least the impact of long COVID, the potential for vaccine escape and the potential for new variants? So will he reassure the House that if the data deteriorates beyond what is currently envisaged, he will not hesitate to take decisive action, not just to save lives, but also to head off the need for a further lockdown that will be so enormously damaging for our jobs and businesses?
Mr. Speaker, I'm very happy to give my right honourable friend that assurance. He's made some excellent points just there. And first of all, I thank him for his support for the government's action. But also, he's right to point out that there is still uncertainty for us, for countries across the world in dealing with this pandemic. And I'm very pleased to assure him that if that risk matrix changes, for example, with variants of concern, we will not hesitate to take the appropriate action.
Let's go to SNP spokesperson, Dr. Philippa Whitford. Philippa.
Thanks very much, Mr. Speaker. I'd first like to associate myself and my colleagues with the Health Secretary's condemnation of the racism sadly faced by members of the England football team after their impressive performance throughout the Euros. Now, turning to COVID, the Secretary of State himself has suggested COVID cases could soar to 100,000 a day once all restrictions are removed next Monday. While research shows hospitalisation rates have thankfully dropped to 3% of cases due to vaccination, this would still mean up to 3,000 admissions, the same as during the first wave. Can he explain how he will avoid such a surge, putting pressure on health services, which would further delay clearance of the backlog of patients waiting with other conditions? With the likelihood of such high transmission rates, how does he hope to prevent the generation of yet more new variants within the UK, perhaps with significant vaccine resistance? Evidence is growing of the debilitating impact of post-COVID morbidity, and the Office of National Statistics estimate it could affect 10% of the